Working in the ER will push you in ways no other unit does. You learn so much, so fast. You become a jack of all trades, able to handle anything from a stub toe to a full blown cardiac arrest. You learn to think quickly, act decisively in critical situations, and stay cool, calm, and collected when it matters most. But here's the thing. That kind of skill and confidence doesn't just happen automatically. It takes time, repetition, and most importantly, intentional effort. Your first month in the ER is critical. It sets the tone for everything that follows. That's why building a strong foundation early is so important. I was lucky to have a great preceptor when I first started, someone who guided me through the chaos with patience and clarity. Now, I want to pass that same support on to you by sharing what I believe are the key essentials every new ER nurse needs to focus on during their first month in the ER. In this video, we're going to break down what you really need to know to survive your first month in the ER, and not just survive, but build a solid foundation. You'll learn how to manage your expectations, what to focus on, how to prepare yourself mentally and practically for this new role. We'll go over how to learn strategically rather than just trying to absorb everything all at once, because that just leads to burnout. You'll also get a clear, realistic goals to aim for during your first month, so you know that you're on the right track. And finally, we'll talk about the power of reflection and how taking a few small steps outside of your shifts can lead to massive growth over time. Let's start with the truth. Your first month in the ER is going to feel like trial by fire. You're going to feel overwhelmed, slow, and uncertain, and that's going to be completely normal. Let me say that again. That's going to be completely normal. Most new ER nurses don't feel confident until their 1 year mark. And there is a reason for that, because by that 1 year mark, by then, you've had enough repetitions. You've seen a wide variety of patients, a wide variety of patient complaints. You've responded to codes. You've helped with strokes, with chest pain protocols, traumas, and everything in between. But it's not just the experience that builds your confidence. It's what you do with that experience. If you consistently reflect, ask questions, write things down, and keep learning from what you see and do, you start building a strong foundation from that first month. And here's the key. It's not confidence that you know everything. That's not what you're aiming for. It's confidence that no matter what comes through those ER doors, you'll be able to prioritize, take a breath when everything's chaotic, lean on your training, on what you've learned, and that you have the confidence that no matter what, you're going to be able to manage the situation. Because by then, you've learned the core principles of emergency nursing: how to assess, how to think, how to act under pressure, and how to communicate effectively with your team. But again, that doesn't happen off the bat. It takes up to even a year for that confidence that you can manage whatever comes through the door for it to build. So again, don't beat yourself up if you're feeling behind or overwhelmed. That feeling is part of the process of being a new ER nurse. And it doesn't mean that you're failing. It means that you're growing. So don't put so much pressure on yourself to be perfect. Just keep showing up, ask questions, reflect, keep learning a little more each shift. That confidence will come one patient, one lesson, one day at a time. One of the smartest things that you can do before you even start on the floor is to prioritize the fundamentals of the ER, your ABCs, ACLS, and PALS. Let's talk about why those matter so much. The ABCs, airway, breathing, circulation, are the core of emergency nursing. Nearly every decision that you make in a critical situation ties back to this. Whether a patient is crashing, seizing, or just short of breath, your job is to recognize what part of the ABCs is affected and act accordingly. Then you have ACLS and PALS. These aren't just certifications that you have to get. They're frameworks for critical situations. ACLS guides you in a cardiac arrest, bradycardia, tachycardia, stroke. PALS helps you with pediatric codes and assessments. These protocols give you structure when the room gets chaotic. If you don't already have your ACLS and PALS done, do them as soon as possible. And if you're already done, then start reviewing repeatedly all the protocols that you learned. The more familiar you become, the more familiar you are with them, the more confident you'll be when it's time to act. And these experiences that you get in the moment will just build upon your reviewing and your reflection. Another game changer that's often overlooked is to bring a small notebook with you on every shift so you can jot down protocols, phone numbers, names, and roles of team members, where supplies are, tips from your preceptors, and anything that you hear that makes you think, hey, I need to remember that, or I need to look this up later. This notebook becomes your own personal ER survival guide. You'll be surprised how much ends up in it. After one shift, after one note, every little detail you capture helps turn that overwhelm into clarity. By focusing on these fundamentals, the ABCs, ACLS, PALS, and just overall taking note as you go, as you can, you're building a solid foundation for yourself. And that foundation is what's going to set you up for success in your first month and beyond. The only way to get through the chaos of your first month is to learn strategically, step by step. You're not going to absorb everything just by showing up. So here's what actually works. First, like we discussed, take notes during your shift. It doesn't have to be perfect, just quick reminders of things you didn't understand, meds you gave, or protocols you saw. The goal is to capture what you'll want to review later on. Again, it doesn't have to be anything fancy, just even a word so that it triggers something later on so that you look things up. Again, the meds that you gave, the protocols that you saw, or just something that you didn't understand. Then when your shift is over and your brain is still processing, you can review these notes, even for just 5-10 minutes, help you solidify what you've learned. But I understand that sometimes after your shift, you are just exhausted, especially when you're new and you frankly just don't want to do it. I get that. So just make sure that at least on your first day off that you take the time to go back and review your notes, to look things up, watch a video or read a guideline on it, or just ask someone, another fellow new nurse, or even your preceptor, but just look them up, okay? And also, very important, reflect on your day. Ask yourself, what went well? What would I do differently next time? What did I learn? And finally, observe your preceptors and other experienced nurses. Don't just copy what they do. Ask why they're doing it that way. That question alone, that question of asking why, can fast track your understanding of what's going on in the ER. Now, look, the feeling of overwhelm will still be there. That's going to be part of it, but don't let it stop you or make you question your place here in the ER. Yes, it's hard. Yes, there's a lot to learn, but if you stay consistent, taking notes, reviewing, asking questions, and moving forward little by little, you're going to find your footing. Just don't get stuck in that overwhelm. Keep going. You're doing better than you think, but again, don't get stuck. Just accept it that it's part of the process and then you're going to come out better on the other side. By the end of your first month, there are a few things you should be aiming for. Not perfection, but a working foundation. Start with your assessments. You want to be able to walk into a room, get the information you need, and be quick and concise without taking too long. It's about being focused and intentional with your questions and your hands-on assessment. Next, for your charting system, you don't need to be fast yet, but you should be figuring out where to document what and how to find what you need. And know your environment, where to find the crash cart, oxygen, suction, IV supplies, where CT and X-ray are, and how to get meds from the PICSs. Knowing your space saves you time and reduces stress, because in critical situations where you need a supply, knowing where it is saves you a big headache. You should also start developing a basic understanding of common ER conditions and workups, like a chest pain workup, shortness of breath workup, abdominal pain, altered mental status, and the common conditions that you're going to see in the ER, like CHF exacerbations, atrial fibrillation with a rapid ventricular response, COPD, pulmonary embolisms, and so forth. These show up often, and you're going to start connecting them also with the meds that you commonly give, like Zofran, Ativan, Cardizem, and so forth. You can also start learning who's who are the RTs that you commonly work with, who's the charge nurse, who are the providers that you're commonly working, who's typically in CT and X-ray. Learn your team is a very important part of, again, becoming part of that team of the ER. And of course, you need to keep reviewing, again, your ACLS, your PALS, and your ABCs. These are your emergency blueprints. You'll keep using them throughout your career, so it's never bad to keep reviewing and to keep refreshing. Now, one last thing. Don't let the ER consume your entire life, but on your days off, especially when you're new. Again, you need to try to dedicate 2 to 3 hours to reviewing, to reflecting, and reinforcing what you're learning. That small, consistent effort will make a big difference. You're not trying to master everything. Again, it's just your first month. Just build enough of a foundation that you don't feel like you're drowning every shift. From here, everything gets easier, but you have to get past that first month and build that solid foundation little by little, and not getting stuck in that overwhelm. Just understand that it's normal, understand that it's gonna happen, and just get through it and push through it. Again, one of the most underrated tools that you have as an ER nurse is reflection. It may not seem like much at first, but it's one of the fastest and most powerful ways to grow. Now, let's be real, 12-hour shifts are exhausting. By the end of your day, you're mentally and physically drained, especially when you're new. So instead of expecting yourself to sit down and study for an hour after each shift, if you can, just do a quick glance through your notes, skim them, highlight anything you didn't understand, and make a small list of things you want to look later on your day off. This sets you up to review and reflect more deeply on your day off when you have the time and energy to actually process what happened. Ideally, we'd review everything right away while it's fresh. But if you're working multiple shifts in a row, that's just not realistic. When you do get a chance, even if it's just once or twice a week, take the time to ask yourself what went well, what was confusing, what would I actually do differently next time so that I can be better. This kind of reflection helps you turn your experience into real knowledge. You'll start to see patterns, understand the decisions that were made, and feel more in control with each shift. These small moments of reflection add up. You don't have to be perfect, again, just consistent when you can. That's how you build a confidence over time. That's why it takes up to a year or longer for you to finally start feeling confident when you walk into the ER and onto your shift, because that's when all the experience, all the review, all the reflecting start showing up in your confidence. Again, focus on the fundamentals, your ABCs, ACLS, and PALS. Take notes, ask questions, review and reflect when you can. These habits are what build you up little by little. And yes, the overwhelm will come. You'll feel like you're behind. You'll feel like everyone else is faster, smarter, and more prepared. That's just the beginning talking. Don't get stuck there. Accept that feeling for what it is, just part of the process, and then move through it. Every shift you survive, every note that you write, every question that you ask, you're getting better. And remember this, you're not alone. Every nurse that you admire, every single one of them started exactly where you are, overwhelmed, confused, even second guessing themselves, but they kept showing up, they kept learning, they kept going. Just know that you got what it takes to. And by the way, if you're finding this helpful, I created a book and a course to help you save time and energy with mastering the chaos of the ER. They're meant to take you from a novice to proficient, ensuring you learn a solid foundation that you can build on. The book comes with all emergency fundamentals that you need as a new ER nurse. The course takes it further with video lessons, practice questions, real scenarios, charting essentials, and overall practical tips to help you feel confident and prepared. You'll find the links in the pinned comment and description below. And as always, teamwork makes the dream work. And here at Emergency Chaos, we are proactive, not reactive.